So I'm going to talk about some subjects that I didn't get around to the last couple tribunals we had, but it's important to educate everyone here about what are the economics and the politics behind all of the terrible policies that we see around COVID, because we are not the victims of bad policy because the policymakers are stupid, even though it would certainly seem that way. But the stupidity of these policies has a real reasoning behind it, and there are real interests behind that. And so I want to just start with the news. Let me share my screen here. I'm sure most people have seen, we now have a death total in the United States of 900,000 people who've died from COVID. And it certainly makes the United States the world leader in deaths. We are number one. And we are also one of the world leaders in per capita deaths, not merely total deaths. So, I want to talk a bit about, okay, why is that? Everyone in the world has the same, virus coming after them. So why would people here be dying in much greater numbers than people in other countries? And it turns out that, of all the different things that affects mortality from COVID, the single largest factor that determines whether you live or die is the country you live in. And that's because of the policies of those countries. So, the United States, we have close to 1 million deaths. It's projected that we will reach 1 million around the month of April. Although that could come sooner, could come later. And that's an extraordinary number when you compare it to, let's say, Australia, which has 2,000 deaths, New Zealand, 51 deaths. China is just around 5,000 now. That's a very different number from 900,000. And China's a much bigger country. China has 1.5 billion people. And yet, in spite of being many times the size of the United States has 180 times more dead people from the pandemic. Per capita, that's even more extreme. If the United States had China's rate of death, using the same policies, in China, the rate of death, China has lost 1 out of every 311,000 people in their population to COVID. We have lost 1 out of 400. If we had China's death rate, we would just be passing 1,000 deaths now. And so it means we can very clearly see that, okay, even if we just copied what another nation was doing, we could have avoided at least 899,000 of those deaths, and probably more. Most people probably know that at the beginning of the pandemic, the Chinese government did terribly. The Chinese government was claiming there is no epidemic, there's nothing to see here, everybody just keep calm and carry on kind of stuff. Really terrible response. And then once it became clear that COVID was going to spread all over the world, Chinese officials realized, oh my goodness, the whole world is going to blame us for this. And so the policies in China got turned around very quickly. And once they did, it was very clear, oh, look, you can actually accomplish a lot using policies to contain the pandemic. And okay, but you still have to ask the question, how can some simple policies cause so great a difference? Could there really be that much of a difference that if we had used the right policies, the US would have closer to 1,000 deaths now as opposed to 900,000? Well, if you take these policies individually, scientists have already quantified just how big a difference all of these policies make when it comes to living and dying. We know one of the biggest, most important policies is around vaccines. Vaccines make a person many, many times less likely to die or be hospitalized by COVID. And one of the main reasons why the US is doing so poorly compared to other wealthy nations is that the US has vaccinated far fewer people. So we can quantify the effect of having mandatory vaccinations and things, many European countries require proof of vaccination for all types of, basic things, from travel to, some basic social services. We can also quantify one of the things that we're raising in these tribunals. What is the effect of school closures? Well, that when you close down schools, you reduce the number of deaths by 58%. So a 58% reduction in deaths just from school closures. Things like masks, especially really good masks, like the respirators that we put on our demands. It turns out those 3 types of respirators are the only masks we have available to us that get you around 90% or greater protection. There was a scientific estimate around the beginning of the pandemic that if at any point in 2020, if the United States had ever gotten around 90% compliance with wearing masks, so getting 90% of the population to wear masks whenever they're in public, our rate of infection would have been going down instead of going up. And that's just one policy. That was before we had vaccines available. And so, you take these things like vaccines, shutting things down, including shutting schools down, masks, things like widespread testing and contact tracing to make sure you isolate all of the infections and prevent them from spreading any further. When you add up all of these policies, things that reduce your percent chances of death many times over, you throw those together, yes, it is pretty easy to see how just using some basic common sense policies can change the effect of this crisis hundreds of times over, just putting all that stuff together. But the differences in policies are so extreme. I always marveled when I was reading different news stories about when New Zealand or Australia or China would shut down a city. And I would find out, they shut down an entire city because of sometimes just 3 cases of COVID being discovered. And I thought that was so remarkable. You can't even get a school shut down over 3 cases in a school in the United States. But New Zealand would shut down its capital city over 3 cases. And and it's not to be painting, any of these countries as heroes. Most of these policies, including the really bad ones, all come from the interest to maintain the economy as being as open and functional as possible. So when the United States has failed to implement any protective measures, it was for the sake of reopening the economy very quickly. And for China, for using its restrictive measures, they had the same goal, get things back to normal as quickly as possible. There is a lot of very irresponsible propaganda on all sides of this. A lot of the anti-China propaganda, is criticizing China for having a lack of freedom in implementing those lockdowns. Let's be serious. We have a lack of freedom here. We are not being given the freedom to keep ourselves safe. Either you have forced lockdowns or you have forced reopenings. Neither one of those things is freedom. It's just that the forced reopenings cause a lot more people to die than the forced lockdowns. So let's inject that bit of honesty into the equation here. Now, what we're talking about with economics, this is not some conspiracy theory. This is something that is discussed very openly. And it has been since the beginning of the pandemic. And if you follow economic news, you're well aware of this. Let's take a conservative business publication like Forbes. Reopening schools is as much about economics as it is about education. This, may not sound like it, but this is an article in favor of reopening schools for the sake of the economy. Schools are as much about childcare as they are about education. Spelling out just kind of very clearly, it's clear that economic considerations weigh as heavily as educational ones. For all those students, and I'm just reading some of the article here, for all those students are missing out, it is not their loss of education that is the key driver behind when they return to the classroom. The reality is, until children go back to school, parents will have to remain at home looking after them, and it will be impossible to fully restart the economy. This is not to downplay the educational loss experienced by millions of students, but without the kind of catch-up program that is both impractical and politically impossible, at some point we will have to accept that a whole generation will have gaps in their learning. Economic considerations also trump health concerns. While many teachers are understandably concerned about the risks of a return to normality, it is not primarily health considerations that are going to determine when schools reopen. And then it talks about England and these things. This article was published way back in May of 2020, and it's not the only one. It's every economics article looks like this. The US economy faces a $15 trillion hit as a result of school closures, according to the Organization for Economic Cooperation and Development. This article also back in 2020, in September of that year. And the OECD said losses to economic growth could be proportionately higher if schools were slow to recover. You even had, among economists, all sorts of opinion pieces, open the schools or kiss the economy goodbye. If you can't get children back in the schools, you really can't restart the economy. And every economics paper and business section has been saying the exact same thing. and you had this echoed by politicians. And Indiana congressman said, well, COVID-19 deaths are the lesser of two evils compared to a hit to the economy. You know, that became quite a stir when he said the quiet part out loud. Yeah, you know, death is not as bad as, you know, having a bad economy. And the Texas lieutenant governor said exactly the same thing. He and other seniors are willing to die to get the economy going. Those of us who are 70 plus will take care of ourselves, but don't sacrifice the country, he told Tucker Carlson. This is the, you know, this is what economists talk about. So when we are, we are not spreading some conspiracy theory here about, you know, what's driving policy. This is what they say is driving their policies. You may have noticed one thing. I'll just go to our BAM website here. People are very conscious of this too. I'm trying to zoom in. Here's a student sign from Chicago. You also tested positive for profiting off putting teachers and students in unsafe conditions. There is some broadening consciousness that that yes, in fact, there is an economic reason why the American population is being put through hell like this. And so we've just been through a series of articles, and these are not the only ones. You can look up COVID and the economy and school closings and all of that. Just do a search for that. You'll find dozens and dozens of articles and opinion pieces by all kinds of economists and political commentators, liberal and conservative, all saying the same thing. The economy is more important than the deaths. That's the essence behind these policies. But that still doesn't explain why is the US so much worse in its policies than so many other countries, including many other wealthy countries. And in many ways, the US situation is the most fanatical. Well, let's put that in context of this fact. The Chinese economy is soon going to be the #1 most powerful economy in the entire world. And that is the most important fact that is driving the insanity of US policymaking. Competition with China is so intense. China suffered a severe hit to their economy due to COVID. It's estimated that they have been operating at only around 90% of their real capacity. And so in many ways, US economists have been pushing for the US economy to be running at a full 100% capacity as really the only shot for trying to keep up with China at all. The fact that China has slowed down somewhat has of course meant that people like the International Monetary Fund have criticized China over their lockdowns, and have been insisting you've got to reopen and have as many deaths as everybody else so that we can be making more riches, and riches have been made. Oxfam International released their report a couple weeks ago that the 10 richest men in the world doubled their wealth during the pandemic, while the incomes of 99% of humanity have gone down. Of course, the rest of us have been suffering from, the pandemic, just being surrounded by death, surrounded by the, inability to, work and take care of ourselves as much as we would want to. Oxfam showed that there's a new billionaire minted almost every day, every 26 hours. And inequality contributes to the death of one person every 4 seconds. There's a particular recklessness on the part of US policymakers because of this international situation, because of the unique kind of economy that the United States has. Most economists don't think it would be possible economically for the US to implement the kinds of policies that other nations have implemented, other nations that have been much more successful in combating the pandemic, because of the kind of economy that the United States is. The United States is unique in being what we call a service economy or a consumer economy. The United States economic activity is overwhelmingly based on consumer services, consumers just going out and spending money. And the US is one of the countries in the world that consumes far more than it produces. You kind of look at the distribution of labor around the world, the US outsources a lot of its labor to other countries, and has most American products produced in sweatshops by poorly paid laborers, places like Malaysia, Taiwan, China, India, Pakistan, you name it. And the US economy, what people are doing here is buying stuff. Most working class jobs in the United States are kind of basic services to consumers, people who are involved in, shipping things, people who, work in fast food restaurants, who work in Walmart and retail, and, most working class people in the United States are adjacent to someone else's shopping addiction. And that is life for most of America's working class. Trying to serve middle class and more privileged people who just buy lots of stuff all day. And so the US economy is very dependent on people just going out to movie theaters, going out to restaurants, just going and spending money every day. And they don't think they can make much money if you take too much in the way of safety precautions. It was discovered that when stores require masks to enter the store, they get fewer shoppers coming into the stores. That was the main factor in persuading the CDC that they had to say, okay, if you're vaccinated, you don't have to wear masks anymore. And so they created this fake honor system. You can, if you're vaccinated, you can, take off your mask. But of course, the people who were taking off their masks were most often the unvaccinated people who were opposed to any health restrictions of any kind whatsoever. This was all just a sham from the beginning. there was even a meeting by the new CDC director, Rochelle Walensky, with the Congressional Commerce Committee. And this Commerce Committee was giving Walensky a very difficult time over the school guidance, saying, well, if you're requiring 6 feet of separation, that's going to reduce the number of people you can fit in a school and make it harder to reopen the schools. And what did Walensky say? Walensky said, oh, well, that's something we can revise because, science evolves. And so, we can change that. Well, the real way science was, quote unquote, evolving was by showing that, 6 feet doesn't provide all that much protection against something that circulates much more broadly in the air. It's actually remarkable to think about a situation in which you have a director of the CDC, someone who's supposedly responsible for public health, answering to the concerns of commerce, who want schools reopened and want to get rid of all these guidelines. But that's the situation we have politically in the United States, and so these are the kind of things that drive America's health policies, or in reality, lack of health policies. This isn't just a small conspiracy of a tiny group of sinister businessmen. It is a tiny group of sinister businessmen, but it's not a conspiracy. This is out in the open. This is discussed, discussed every day, and out in the open for everyone to read. And so, we can see the practical difference that this makes. We would be far better off having the death toll of a New Zealand or China and be approaching 1,000 deaths instead of 900,000 deaths. We are only in the situation we are in because our policymakers have decided that, like the Indiana congressman said, well, deaths are the lesser of two evils.
My business.
So that's the situation we're in, but it's also one that I just keep repeating. This is something that isn't just tragic, but there's a reason why we can be optimistic knowing this, knowing that policy has such an overwhelming effect on how many people die. Just the policies that we have outlined in our literature. Shutting down in-person schools, mandatory vaccinations, mandatory mask use, PCR testing, expand paid leave and economic assistance, end racist second-class treatment of minority and immigrant communities. We know these things can have an enormous effect on who lives and who dies, and it can have that effect hundreds of times over, and policies are something we can change. It would be one thing if policies had no effect and everyone in the world was just going to suffer the same way from the virus. But if you have the choice between millions of people dying or only a small number of people dying, you can make that choice. The problem is that choice has been made for us by people more powerful than we are. And the challenge we face is, how do we make ourselves more powerful than them? That requires building a movement. And that's the purpose of these tribunals, is to raise the level of consciousness and understanding of the leaders and organizers of that movement. And the last thing I'll say on the politics of this pandemic, obviously in the United States, we are in an especially crazy situation politically, with lots of anti-vaxxer politics, and even people who still deny that COVID is real. There are masses of people, including an NFL quarterback or two, who want to believe that taking a horse parasite drug is better than taking a vaccine. There is now a trend of people who, instead of taking vaccines, are drinking their own urine, and saying, don't trust those vaccine makers, drink up, drink your urine, and that'll make you safe. And Donald Trump was proposing, well, maybe we just inject ourselves with bleach. And so this looks so insane. It's hard to believe you can, get on social media and see some anti-vaxxer drinking his own urine and saying, this is what keeps me alive. But why this kind of social madness in American politics? We have in this country a neo-fascist movement, and it's important to talk about what the politics of fascism really mean. Fascism always involves an enormous amount of falsification. It always involves a big lie. When fascism ended up taking power in Italy and Germany a century ago, it rose to power on the big lie of white superiority and the dangerous influence of Jews and immigrants and foreigners in Europe. And science has a particular problem for fascist ideology, which is that scientific truth isn't based on anyone's authority or superiority. Scientific truth is a kind of humbling thing. Truth is something that has to be proven. And it doesn't matter who you are, it doesn't matter how important you are, the truth is more important than you. And for most of human history, the truth has never worked that way. The truth is whatever the king says is true. The truth is whatever someone in authority says is true. And that's the way philosophy and religion have always worked. You don't have in a religious setting, people raising their hands and saying, well, I think our deities are like this, and I think their rules are like this. Everyone would invent something totally different. You need to have a system of authority for determining what the real doctrine is. And that's the majority of human history right there. And it's something that's only too natural for people who are not educated in science to believe in. I remember a story of one teacher who had an impossible time teaching a particular student that climate change, the climate crisis was real. And this student was just like, objecting. So you're telling me that whatever a scientist says is automatically right? The student couldn't get around the idea of authority being the source of truth. But of course, that was never the issue. It's never the case that whatever a scientist says is correct. Scientists have to prove what is true and prove what is not true. And they are constantly disproving each other. They have to subordinate human authority to a level of truth. And that is something that fascism can never do. Fascism is built on the idea of some people being inherently superior to others. And whatever they say, no matter how crazy it is, has to be true because of who's saying it. And that is exactly their attitude towards people like Donald Trump. Any completely ridiculously stupid thing that Trump ever said has to be more true than any scientific fact. And many people in the neo-fascist trends are also very conscious of the fact that they have to reject science because science says all sorts of things that mean you need to change the economy in order to save human life from the climate crisis and from pandemics, and that's just too much for them to bear. But we have a very real interest in science, not just because we are interested in the truth, but because we're interested in what the truth means socially and what the truth means about our relationship to each other. Having to prove the truth and be accountable to that means we have a shared reality that belongs to all of us, that we're all in the same thing. We don't live in separate universes of, hyper individual realities. And the truth is a basic measurement of our accountability to each other. It measures that we are willing to relate to each other in a way that isn't just, it's my way or the highway. It's, we all have to be accountable to certain things that are greater than all of us. And human life is very short. And it keeps on going after all of us are gone. And in contrast to the hyper-individualism of the neo-fascist trends, you can't tell me what to do, I'm superior to all. We have a more social view, something that is capable of embracing other people and working together and looking for the best in each other. And we are in many ways going to be the people responsible for building a movement on that basis. We don't see any governments in the world, any policymakers who are willing to be that accountable to the truth. We don't hear much in the way of real science coming from any of our policymakers, and we are some of the only people in the country raising the simple scientific fact that something as basic as school closures can reduce the number of cases and deaths. And so it's no accident that in order for science to become even a source of great authority, in order to move beyond the time when the king decided what was true, well, that actually required a period of revolutions in which kings had to be overthrown. That's why we got the scientific revolutions that we did. And So it's really it's really an imperative, not simply to embrace science as like some, super moral imperative, but as a way of embracing each other, as a way of, of embracing a common reality that we all share. We cannot simply say, oh, I'm going to protect myself, and if those other people don't want to protect themselves, that's up to them. It doesn't work that way. The more this virus is allowed to spread, the more it endangers everybody. We cannot take an individualistic view. And one thing that not only BAMN has been saying, but many people have been saying, we are not safe until everyone is safe. And that is the scientific truth. And it's on the basis of that truth that we can lead a movement to save lives, and we know the policies exist that can make that a real possibility. And so, just once again, I salute the teachers and the students and everyone who's been fighting around, getting these schools shut down and fighting for remote learning and mandatory vaccinations. You are the people fighting to save lives. You are the leaders that our society